All right. So now let's begin. A patient was admitted to the surgical department with a suspected inflammation of the Meckel's diverticulum. What part of the bowel should be examined in order to discover the diverticulum in course of an operation? Now, this one is anatomy, okay? But usually this Meckel's diverticulum normally is found on the small intestine. It is found on the small intestine. So over here, we are looking at what? The distal ileum. The distal ileum. Distal ileum. So over here, we're looking at what? At ileum as our likely answer. Ileum. Ileum. All right. Examination of a newborn boy's genitals revealed a cleft of urethra that opens inferior to his penis. Inferior, guys, inferior. What developmental anomaly is it? Now, if they tell you it is inferior or the cleft of the urethra, that is the opening of the urethra where urine passes. If they tell you it is inferior to the penis, that should tell you that this person has developed a called what? Hypospadia. Hypospadia. Now, if they tell you it is superior, definitely to be what? Epispadia. Epispadia. So take note of these two things. Now, in the absence of any testis, we call it the cryptorchidism. Cryptorchidism. That's absence of a testis. Okay. Or it was not able to descend down. That's what we call it. So again, if it is the cleft or the urethral opening is below, we call it what? Hypospadia. If it is superior to the penis, we call it what? Epispadia. Epispadia. All right. So over here, we're looking at what? At hypo, because it's inferior. Inferior. Okay. A patient complains about impaired evacuatory function of the stomach. Evacuatory function of the stomach. That is long-term retention of food in the stomach. You know, talk about evacuation, that means the ability of the food to move away from the stomach, isn't it? Or to descend. Now there's a problem. And that's so we have what? A long-term retention of the food inside the stomach. Now, examination revealed a tumor of the initial part of the duodenum. Initial part of the duodenum. So specify the location of the tumor. Guys, this one, we have talked about all the part of the duodenum, isn't it? We've talked about some of the part of the duodenum. But basically, we have about 4 parts. We have 4 parts. So one, we have the superior part. Superior part. Now, this superior part is just a continuation from the pylorus or from the pylorus. On top of the pylorus, that's like the pyloric part of the stomach. You know, the pyloric part of the stomach is like there's a sphincter that's, gets into the duodenum. That part of the duodenum is called the superior part. That part of the duodenum is called the superior part. Now, the descending part begins at the superior duodenal fissure. The superior duodenal fissure. Again, these things you need to have a diagram. Then we have the horizontal part. The horizontal part also begins at the inferior duodenal flexure and passes transversely to the left. And last but not least, we have the ascending part where it passes upward, joining with the jejunum at the jejunal flexure. So these are the various parts of the duodenum. Again, we have the superior part, we have the descending part, the horizontal part, and the ascending part. If I were you, I would try and get a diagram of how the duodenum is, being arranged or how it looks like. Now, like I said earlier on, with the superior part, that one is just a direct continuation from the stomach. So over here, we are going to go for what? The superior part. The superior part, or part superior. The superior part. All right. A man after 1.5 liters of blood loss has suddenly reduced diuresis. That means because of the blood loss, there's decreased amount of what? Fluid. I mean, urine. Decreased amount of urine. There is decreased amount of urine. Now, the increased secretion of what hormone caused such diuresis alteration? So if you ask yourself, what hormone can lead to a decreased level of urine formation, or can prevent urine from coming out? What hormone? What hormone? What hormone? And of course, you are looking at what? The anti-diuretic hormone. Anti-diuretic hormone. So they say anti-diuretic, that means it prevents what? Urination, or it reduces urine output. So anti-diuretic hormone is increased in this patient. And another name for the anti-diuretic hormone is the vasopressin. 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 All right, so over here we are looking at what? At vasopressin, or vasopressin. So the answer is E. A young man consulted a doctor about a disturbed urination. Okay. Examination of his external genitalia revealed that the urethra is split on top, guys, on top. On top. In other words, superior, isn't it? And the urine runs out of this opening. That is, the urethral opening is on top, is superior. So again, I explain, if it is superior, we call it what? Epispadia. If it is inferior, we call it hypospadia. So over here, we have what? Epispadia. So your answer is E. A 35-year-old patient applied to a doctor with complaints about having an intense rhinitis, that's like runny nose, and loss of sense of smell for a week. Loss of smell for a week. Now they are saying that one of the signs and symptoms of COVID-19 is loss of smell. So the question now is, where is your sense, or where can you find the receptor for this sense perception? For this sense perception, or in other words, and the name of the receptor is called the olfactory receptor. So where can you locate this olfactory receptor? And usually the olfactory receptor, or the sense of smell, is located in the superior nasal concha. Superior nasal concha. Now, if you try and then look into your nose, there are some cavities divided. We have superior, we have inferior, and then we have what? Middle. Again, we have superior, middle, and then inferior. Now, the sense of smell is found on the superior concha, or the superior opening, or turbinate, or meatus. They are the same thing. So it is found on the superior side. That is where you can find the olfactory receptors. So over here, we're looking at what? The superior nasal meatus, or nasal turbinate, or nasal cavity. Anyhow you want to pronounce it. I mean, you want to look at it, or concha. All right, so answer is A. Inflammatory process of modified subserous layer around the surface of the uterus, cause an intense pain syndrome. What region of the genitals does the pathological process take place? So now we're looking at what? The subserous layer of the cervix of the uterus. So basically, we're looking at what? The fibrous and then the fatty connective tissue that is surrounding the uterus. The fibrous and then the fatty connective tissue that is surrounding the uterus. And over here, we are definitely looking at what? At a parametrium. 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 So over here, we are looking at what? At A, parametrium. And again, this parametrium separates the supravaginal portion of the cervix from the bladder. It separates the supravaginal portion of the cervix from the bladder. From the bladder. And again, the key word here that is helping us here is what? We're having a modified subserous layer. Subserous. That means an outermost layer. Outermost layer. The outermost what? Layer. All right. So the answer is A. The answer is A. All right. In the course of an operation, a surgeon removed a part of a lung that was ventilated by the tertiary bronchus, accompanied by branches of pulmonary artery and other vessels. What part of lung was removed? What part of lung was removed? So again, we are talking about what? Tertiary what? Bronchi. Tertiary bronchi. Tertiary bronchi. And we'll talk about the tertiary bronchi. Don't forget we have the bronchial tree, isn't it? Good. So over here we are talking about the bronchopulmonary segment, because the tertiary bronchi, that's more or less like the bronchioles. So directly it supplies into the what? The lungs tissue, isn't it? So we call it bronchopulmonary segment. Bronchopulmonary segment. Bronchopulmonary segment. So another name for the tertiary bronchus is called the segmental bronchi or segmental bronchus. Segmental bronchus. So that is why over here we are looking at what? Bronchopulmonary segment. So your answer is D. Is D. Is D. All right. While examining the oral cavity, a stomatologist revealed inflammation of the papillae on the border of the median and the posterior third of the back of the tongue. What papillae are inflamed? Again, your clue here is what? Papillae are found on the median. Median, that is like on the middle of your tongue. Then the posterior third. So if you open or if you bring your tongue out, where it is getting into your throat, that's the posterior third of the tongue. So what papillae are inflamed? What papillae are inflamed? All right, so now let me give you guys some few distinguishing between them. So let's distinguish between these things, some few differences between these papillae. So we have the filiform papilla. These are the smallest. The filiform are the smallest, but most numerous. Small, but they are a lot. They contain no taste buds. They contain no taste buds. These are found on the entire anterior dorsal surface. The entire anterior dorsal surface. Anterior dorsal surface. Good. They have no taste buds. They have no taste buds. Okay. Foliate papilla. Foliate papilla. These contain taste buds. They contain taste buds. And they are found on the lateral edge of the tongue. So your lateral edge of the tongue is where the taste buds are found. That's why if you realize if you're eating some toffee or something like that, the food eventually ends up on the corner of your mouth. it doesn't usually fall on top of the tongue. Usually goes to the corner. If you can be true to yourself, that's because the taste buds are found over there. So you feel that wow, there's sugar in this thing. This is bitter. Aha. Lateral. That's foliate papilla. They are lateral on the lateral edge of the tongue. Lateral edge of the tongue. Lateral. Then we have the fungiform. The fungiform. They also have taste buds and they have the shape of a mushroom. They have taste buds and they have the shape of a mushroom. Mushroom. All right. Now we have the circumvallate. The circumvallate. The circumvallate. So these are found just anterior to the sulcus terminalis. So the vallet, they are found on the anterior to the sulcus terminalis. To the sulcus terminalis. And they divide the tank into the anterior 2/3 and the posterior 1/3. And it contains taste buds as well. Taste bud as well. So these are the ones that are found on the posterior or basically the posterior 1/3. Posterior 1/3. That means at the back, if you're coming from the back, that's the posterior 1/3. So over here, we are looking at what? At a vallet. I've taken my time to spell all this out so that you can know the differences between them. So we have what? D, the vallet. Examination of a patient revealed an abscess of the Pterygopalatine fossa. Where can the infection spread to unless the disease is managed in time? Where can the disease spread to? So we have the what? The Pterygopalatine fossa. The Pterygopalatine fossa. Now this fossa communicates with the nasal and the oral cavities. This fossa communicates with the nasal and then the oral cavity. It also communicates with the infratemporal fossa, the orbit, the pharynx, and then the middle cranial fossa. And then the middle cranial fossa through the 8th foramina or the 8th hole. Again, this Pterygopalatine fossa communicates with the nasal and the oral cavities, the infratemporal fossa, the orbit, the pharynx, and then the middle cranial fossa. The middle cranial fossa. Therefore, looking at the options that we have over here, our best bet would definitely be what? Be the orbit. The orbit. The orbit. So your answer here should be D. All right. During complicated labor, the symphysis pubis was ruptured. What organ can be damaged? Mostly. So you ask yourself, if you put your hand on your lower abdomen, the middle part of your lower abdomen, what can you normally palpate over there? Of course, you are thinking of your urinary what? Bladder. You are thinking of your urinary bladder. And the ladies can, of course, they know this one very well. Though you're not pregnant, but you know it. So your bladder, the pubic symphysis. That's where the two bones come to join together anteriorly. The two hip joints come to join anteriorly. So please take note of that. So when you're looking at what? The bladder. And the bladder is where urine are stored. So in men with prostate cancers, because there is a blockage to the outflow of urine, the place will become what? Bulgy. Because there's too much of fluid inside the bladder. That's just by the way. So here you're looking at what? The urinary bladder. All right. A patient with cholelithiasis, that's like stones in the gallbladder, fell ill with a mechanic jaundice. Examination revealed that the stone was in the common bile duct. What bile secreting ducts makes up the obturated duct? Sorry. In other words, where is the obstruction? Where is the obstruction? So you must understand that the common bile duct, that is where all the structures responsible for bile release, they all converge. So it will come from the liver, from the gallbladder, and partly from the pancreas, because they also have bile secreting something over there, isn't it? Good. So again, that's what we're looking at over here. So the common bile duct forms in the porta hepatica as the result. That means from the porta, the hepatic portal vein, or the hepatic portal vein. This is formed as a result of what? The common hepatic duct that is coming from the liver directly. So the duct coming from the liver, and then the cystic duct. That's the duct coming from the gallbladder. So together they form the common bile duct. Together they form the common bile duct. So over here, you are looking at what? The hepatic communis and then the ductus cysticus. That is what? The common hepatic duct and the cystic duct. So these all come together to form the common bile duct. They come together to form the common bile duct. So when there's an obstruction in any of these areas, of course, we can have a mechanic jaundice. A mechanic jaundice. So here your answer is A. A neurological examination of a 65-year-old patient revealed a hemorrhage within the superior temporal gyrus. Superior temporal gyrus. So in the blood supply area, of which artery is it? So in the middle temporal area. So just where your ear is, okay, just touch your ear. So that side is where we have the temporal what? Gyrus. That's where we have the temporal gyrus. And over here, it is surrounded by the medial cerebral artery. So the nerve over there, so the arteries over there, we call it what? The middle or the medial cerebral artery. The medial cerebral artery. So over here, we are looking at what? At the middle or the medial cerebral artery. So that vessel could be the problem where there is what? Bleeding. All right. And that part of the brain supplies so this artery supplies brain with a lot of what? Blood. Good. A 70-year-old man has cuts, and is having an has cut an abscess off. Okay. A 70-year-old man has cut an abscess off in the area of mammiform process during shaving. Okay. Now, 2 days later, he was admitted to hospital with inflammation of the arachnoid membranes. How did the infection penetrate into the cavity of the skull? Now, you know the arachnoid is part of the brain tunics, isn't it? We have the dura mater, the pia mater, the arachnoidal matter or membranes. How you want to pronounce it? Now, the question now is that when the person was shaving, there was a problem. And as a result, an infection has entered into the brain tunics or into the brain. So the question now is, how did the brain enter over there? How did the brain enter over there? So over here, we are looking at what? The emissary veins. The emissary veins. And what are these emissary veins? The emissary veins connect the extracranial venous system. The extracranial venous, that means veins that drain but are not inside the brain. So they connect the extracranial venous system with the intracranial venous sinuses. I repeat, these emissary veins connect the external veins or venous system to the intracranial venous system or sinuses. Okay. And because of that, if there is a problem in the scalp or there's a problem from the scalp definitely it can easily penetrate through the skull into the meningeal veins and then the dural venous sinuses. Basically, that's what it is. So the emissary veins connect all of these things together. The emissary veins, the emissary veins. So over here, we're looking at what? At B, the emissary mastoidi. All right. Again, this connects the extracranial vessels to the intracranial vessels. So anything that happens to the outside, easily it can penetrate into the skull and affect the brain tunics. All right. Cerebrospinal fluid is being examined for the purpose of a differential meningitis diagnostic. What is the site, guys? You know the site already. L3, L4, L3, L4, L3. The space between it. The space between. And you know where you can find this cerebrospinal fluid, right? At the subarachnoid space. The subarachnoid space. So actually, when you do this, we're looking at what? The subarachnoid space. All right. While preparing a patient to the operation, the heart chamber's pressure was measured. In one of them, the pressure changed during one heart cycle from 0 to 120. Guys, what is the pressure in the left ventricle? Of course, 120. And that's why sometimes we say the systolic volume, which is what? The ventricular volume. Systolic is what? 120. 120. That's what we say 120. And then the diastolic is what? Is 80. So over here, we're looking at what? 120. 120. So 120 means we are dealing with what? The left ventricle. The left ventricle. So the answer is A. Part of alveoli. Is that alveoli? No, alveolus of a preterm infant. Preterm infant did not or didn't spread because of enhanced elastic, yes, so it's alveoli. So part of the alveoli of a preterm infant, that is underage baby, did not spread because of an enhanced elastic recoil of the lungs. How can this recoil be reduced? Guys, the reason why if you are giving birth to a preterm baby, you give a glucocorticoid is because you want to introduce or you want surfactant to be there or to be matured. Because without surfactant, your lungs cannot be able to withstand the kind of diffusion and then all those things you do, or the surface tension. It will be compromised. So over here, you need what? A surfactant. So children under age, we give them glucocorticoids or prednisolone so that it can help them. Sorry, there's a metazone. That's the right glucocorticoid that is given. Dexamethasone. Let me not give you any wrong report. Dexamethasone. Good. So that is what is used to help the surfactants to grow. All right. So what you're looking at the surfactant. We're looking at the surfactant. All right. And you know surfactants are divided. They have two types. We have the type 1, type 2, isn't it? Type 1 is involved in exchange of gases, whilst type 2 is involved in the cell wall, or the alveolar cell wall. All right. Okay, preventive examination of a patient revealed an enlarged lymph nodes of the metastatic origin in the medial wall of the left axillary crease. Okay? Specify the most likely location of the primary tumor. Again, there's an enlarged lymph node that is of a metastatic origin on the medial wall. Now, the ladies can, know this better because they have breasts anyways. Guys don't have breasts. Ladies have breasts. So usually when you have a breast cancer, easily it can move to what? Your axillary or your armpit area. So that's what they're talking about. So the medial aspect of the axillary what crease. So over here you are thinking of the origin coming from what? The breast. So over here you're looking at the breast cancer or the mammary gland. The mammary gland. Mammary gland. So your answer is what? D. Mammary gland. A man is suffering from osteochondrosis. Osteochondrosis got acute pain in the abdominal muscles. That's the lateral and in the anterior. During objective examination, a physician diagnosticated increased pain sensitivity of the skin in the hypogastric region. Hypogastric region. Hypogastric region. This pain might be caused by affection of the following nerve. The following nerve. So over here they told you about there is what? Pain sensitivity where? At the hypogastric region. That is below the stomach. Below the stomach. Below the stomach. So if you look at your options here, which one gives you a better option? Of course, you are looking at what? Iliohypogastric nerve. Iliohypogastric nerve. And this generates from the lumbar plexus and a supply sensation to the skin over the lateral gluteal region and then motor to the internal and the transverse abdominal muscles. Again, this originates from the lumbar plexus, supply sensation to the skin over the lateral gluteal region and the motor to the internal and then the transverse abdominal muscles. So again, it gives the clue that we're having what? Iliohypogastric. Iliohypogastric. A woman is suffering. Hey, not the same thing. Okay, it's a different thing. A woman is suffering from what? Osteochondrosis. Felt acute pain in her left humeral articulation. That's your shoulder area. That became stronger when she abducted her shoulder. Again, on top about abduction, that means the ability to what? To move your hand away from your body. Away from your body, laterally. Away from your body. Now, these symptoms are caused by the damage of the following nerve. So you ask yourself, what nerve is found around the axillary? Around the axillary, around the armpit area, around your shoulder area, your shoulder joint. What nerve are they looking at for? What nerve are they looking at for? Don't forget, we're talking about the muscles. For the muscles, we will have looked for the deltoid muscle. We've done it. For a muscle, we would have looked for the deltoid muscle. Okay, but this is not a muscle. So this deltoid muscle is supplied actually by it's supplied by the axillary nerve. By the axillary nerve. So that is the nerve that is causing that pain in this area. So here, your answer is E, the axillary nerve. And again, the axillary nerve supplies the deltoid muscles because that is involved in abduction. In abduction. In abduction. All right. Uterography X-ray photo showed a renal pelvis with minor calyces only. Now, major calyces were absent. What form of urinary tract of a kidney was revealed? Now, you can find minor calyces, but you can't find major calyces. And this means that this person is not mature. This person is still in the what? The embryonal developmental stages. Embryonal developmental stage. I don't want to bore you guys with the embryogenesis of kidney development or nephrogenesis. But basically, over here, since the major ones are not yet formed, basically, this person is still in the embryonal developmental stages. So over here, your answer should be what? Should be E. Embryonal stage. Embryonal stages. All right. A patient has a deep cut wound on the posterior surface of his shoulder. Posterior, guys, look, posterior surface of his shoulder. In its middle third, what muscle might have been affected? So now you look at your muscles. What muscles are located on the posterior surface of your shoulder? The posterior surface of your shoulder. In its middle third, that means talking about the humerus area, the humerus, okay? The humerus. So posteriorly, what muscle is there? The humerus. Posteriorly, what muscle is there? Of course, you are thinking of what? Your triceps. They say anteriorly, of course, bicep. But posteriorly, we're looking at what? Tricep. So your answer should be B. Tricep. Tricep. All right. A patient has pain, edema, and reddening of his skin in the anterior superior area of his thigh. Anterior superior area of his thigh and his foot thumb. What lymph node of his lower extremity responded to the inflammatory process? So, guys, you must know that definitely you're going to look at what? The inguinal lymph node, isn't it? Why? Because they are saying that these things occurring at what? At the groin area, your groin, Groin, groin area. Sometimes you can see some node over there. Sometimes when you get injured on your foot, one of the somebody has experienced before. You heard that your groin area, there's some mass over there. That's because of what? Lymphatic drainage from the wound. So usually we have two types of the inguinal lymph node. We have the deep and then we have what? The superficial. And usually it is the superficial that drains from all these areas or that receives lymphatic drainage from, example, from the penis, the scrotum, the buttocks, the abdominal wall below the level of the umbilicus, back of the iliac crest, the vulva, the anus, the thigh, the medial side of the leg, and the lateral side of the leg, and so on and so forth. Again, this drains the penis, the scrotum, the perineum, the abdominal wall below the level of the umbilicus, the buttocks, the back, the back below the level of the iliac crest, the vulva, the anus, the thigh, the medial side of the leg, and so on and so forth. And so on and so forth. So over here, we're looking at what? The superficial. The superficial. The superficial. A patient got a craniocerebral trauma. Craniocerebral trauma that resulted in a right-sided convergent strabismus, damage of which nerve has caused these consequences. So basically, when we talk about the strabismus, it's a condition in which the eye do not properly align with each other when looking at an object. They do not properly align with each other when looking at an object. And usually, we are now we have three major nerves, okay, that are responsible for eye movement. Three major nerves three major cranial nerves that are responsible for eye movement. Eye movement. And these can cause a strabismus. These can cause a strabismus. So one, we have the how do you call it? The lateral rectus muscle, because don't forget, for every movement, there must be muscles there, isn't it? So now the lateral rectus muscle of the eye abducts the eyeball. It abducts the eyeball. In other words, it pulls it away from the midline, right side. Again, it helps in what? In abduction. Abduction. UCT. Abduct. It helps in what? In abduction. That is, it pulls the eye away, or the eyeball away from the midline. It pulls it away from the midline. And it is supplied by the abducent nerve. Supplied by the abducent nerve. So what it means is that if there's a lesion of this nerve, it will lead to failure of the eye to abduct, or right side convergent strabismus. Right side convergent strabismus. So right side means moving it away from the midline. Right side. So just try and then do that muscle. Let's see. Try looking on your right side. Try look on your right side. Good. So if you look on your right side, you are moving it away, and that is controlled by the abducent nerve. All right, so that's over here. When there's a damage to that nerve, there will be a problem. So damage to that nerve, there will be a problem. All right. In the case of penetrating wound of the anterior abdominal wall, the wound track went above the lesser curvature of the stomach. Again, our favorite question. Lesser curvature of the stomach. So what peritoneal formation is most likely to be injured? What is most likely to be injured? So over here, from the option over here, definitely we are going to look at what? At the hepatogastric ligament. Hepatogastric ligament. Why? Because lesser curvature, that's more or less like the anterior side, isn't it? And the anterior is close to the liver. So that's why we have what? The hepatogastric ligament. So over here, looking at what? At B. That ligament would be impaired, or there will be a problem over there. All right. After a trauma, a patient lost ability of elbow extension. That is, you cannot straighten your arm. That is what? Elbow extension. So this might have been caused by the dysfunction of the following main muscles. So what muscle is responsible for straightening your elbow or straightening your arm? What muscle is responsible for straightening your arm? And of course, you are definitely looking at what? At the tricep brachii. The tricep brachii. The tricep. Now, the bicep will be used for what? For flexing or for flexion. That is moving the elbow closer to your body. Moving the elbow closer. So take notes. Over here, we're looking at what? At the tricep. So the answer is E. A patient has been diagnosed with a compression fracture of the lumbar vertebra. As a result, he has a considerable increase in curvature of the lumbar lordosis. Which ligament damage can induce such changes in spine curvature? So usually, when we talk about lumbar, lordosis, it's when we have an excessive inward curve of the spine. Excessive inward curve of the spine. Inward curve of the spine. So that's what it simply means. And usually we are looking at the anterior longitudinal ligament. The anterior longitudinal ligament. That can lead to lordosis. It can lead to lordosis. All right. So the answer is what? Anterior. Because it runs down the anterior surface of the spine. And if there's a curvature inwardly, that means the anterior part is definitely affected. Of course, the opposite will be true for the posterior one because it's happening on the posterior side. So if there's an outward, then basically you're thinking of the posterior one. So over here, you're looking at what? At the anterior longitudinal ligament. Anterior longitudinal ligament. After craniocerebral trauma, a patient lost the ability to execute learned purposeful movement. Learned purposeful movement. The injury is most likely to be found in what? Of course, this is what? Supramarginalis. Supramarginal, because that is the part, it's a part of the parietal lobe anyways, and it's the area that is responsible for, how do you call it? For learning. Is the place for learning, or is the, it's the organ for learning, or the gyrus for learning. So anytime you are learning, that is the gyrus that is coming to play. That's the gyrus that is coming to play, the supramarginalis. Supramarginalis. So your answer is what? Is D, supramarginalis. A patient got an injury of the spinal bone in a road traffic accident that caused loss of tactile sensation, posture sense, and vibration sense. What conduction tract are damaged? So now there's tactile sensation, or loss of tactile sensation, posture, and vibration. So definitely you are thinking of what? The gracile fasciculus. The gracile fasciculus. And then the cuneatus. The cuneatus. The cuneatus. So I don't know if you guys have done a neurology already, but if you start doing neurology, you will see that some pulses that are controlling those tactile, the posture, and all kind of thing, they go through this thing called the gracilis and then the cuneatus. The gracilis and then the cuneatus. The gracilis and then the cuneatus. So I'll not waste my time on it, but I'll let you read much on this gracilis and cuneatus because it forms part of the innervations. So it is found in the spinal cord anyways. So when that part of the spinal cord is damaged, definitely these areas can't be affected. And usually they provide proprioception for the lower limbs and then the trunk. They provide proprioception. And the cuneate also helps in what? The upper part of the body, that the neck, the trunk, and then what? The arms. So it gives it the tactile sensation of vibration, and so on and so forth. So that is why over here you need to understand. So again, you're dealing with what? Gracilis and cuneatus. All right. So your answer is what? A. Your answer is A. All right. Examination of a patient revealed hypertrophy, and inflammation of the lymphoid tissue. There's edema of the membranes between the palatine arcs. What tonsil is normally situated in this area? What tonsil is normally situated in this area? They've already given you palatine tonsils. Palatine tonsils. Palatine, they've told you the answer already. Palatine tonsils. So over here, looking at what? The tonsilla palatina. The tonsilla palatina. As simple as that. As simple as, so the answer is what? Is A.